Volunteers in Medicine is a free clinic for the uninsured who live in Deschutes County. They don't make enough to afford insurance. They are not eligible for Medicaid or Medicare, and we provide free health care for them in a primary care setting.
Volunteers in Medicine really brings together two factions. One is a whole lot of expertise in our communities from physicians, other kinds of care providers, with a specific population of people that really need those kinds of services.
There's a very great need for our services in Deschutes County. We think there are about 30,000 people in our county who would qualify for services. Of that, we can serve about 1,500 at any given time.
Those people are working people who don't have jobs that can provide insurance and don't make enough money to buy their own insurance.
The clinic's here to help people basically with their health needs, people that have slipped through the net, so to speak. And we are a safety net clinic and trying to help people who don't have any access to go anywhere else.
The alternative in towns where there isn't a clinic like Volunteers in Medicine is the patient usually gets more and more sick.
They have no other recourse but to perhaps look at an emergency room as their only care for primary services. That's the niche that Volunteers in Medicine tries to resolve.
You know, here at Volunteers in Medicine, we are able to provide not only primary care, but we're able to provide prescription drug assistance, referral to dental care services, mental health services.
We actually have a blood pressure and lipid clinic. We have gastroenterology, gynecology, neurology, ophthalmology, orthopedics, podiatry, and general surgery.
We have support from not only St. Charles and the Ben Memorial Clinic, but from providers in every single specialty that exists in Central Oregon. We have over 350 volunteers, and they represent all different areas of healthcare.
And I think what I try to emphasize when I talk to the volunteers is that, you know, the patients that you see here would not otherwise be seen. You're doing something really special. You're serving them in a way that's really is a wonderful thing.
What we really strive to be is a primary care home for our patients, and that means really addressing the preventative care needs for people who have chronic conditions. Our biggest diagnoses are things like asthma, high blood pressure, diabetes, and mental health concerns, and all of those are very well treated on an outpatient basis.
And so it is really important that we have a comprehensive medical community that backs up the building, backs up our location, backs up all the community support with real live hands-on care that our patients need.
Our volunteer doctors are largely retired, and they very much like serving at Volunteers in Medicine because they get to practice medicine the way, you know, at its most pure level. And the same with nurses. And also we have quite a few students that work at Volunteers in Medicine as part of their education.
The feedback I get is they just derive a great deal of satisfaction using their skills and talents to help people who otherwise wouldn't be able to get help.
One unique addition that we have at our clinic compared to most primary care clinics is our charitable pharmacy. We're able to accept donated medications from other pharmacies from the hospital.
One of the great things about Volunteers in Medicine is how highly leveraged the money that we raise is, and that's really due to the volunteer network. For every dollar we have to raise in cash, that's leveraged about 7 times by the volunteer efforts and by the donations of all the clinics that we're affiliated with around town and the hospital.
There is a growing need of the working poor, that people are trying to do their level best to accommodate the economy, accommodate having to have more than one member of the household working, not having access to care. That need is going to continue to grow.
It's interesting, actually. The feedback I get in the community is, number one, everyone very much appreciates the service that's provided by Volunteers in Medicine, and particularly the volunteer efforts that go into it. But additionally, I've noticed over the last 2 or 3 years, the community now thinks of Volunteers in Medicine as an essential element of the community.
Volunteers in Medicine, in a sense, is a medical home for our patients. They have a place that they can call or come to if they have a medical problem.
We are a local organization. This is where our hearts are. This is where our volunteers are from, our patients are from, and our support is from.